Good morning, good afternoon, good evening, and a very warm welcome to this Mott MacDonald webinar. I'm Simon Harrison, Head of Group Strategy for Mott MacDonald, and thank you very much for making the time to join us. COVID-19 has affected us all, both personally and in our professional lives, but in different ways around the world. As vaccines offer hope of a way out, their uneven distribution globally, together with a range of other factors, will mean the nature of exit varies place by place. How do we make sense of this when plotting the future paths for our organisations and businesses? It feels like driving through fog. Mott MacDonald unusually has teams of health professionals, including epidemiologists, who have applied the skills they normally deploy in solving a range of global health problems to the challenges infrastructure and other operators face as they navigate this strange world. We have science-based, independent insight into how things are likely to evolve, and working with our infrastructure professionals, we have created this webinar as a contribution to a greater understanding of how we all need to respond. I'm delighted we have a global audience today, which creates a wonderful opportunity for us all to share experiences. Although inevitably this means we will have to gloss over the particular ways in which different countries are handling matters. Our presenters will be speaking for about 20 minutes, after which we plan an extended period of questions and answers. Please do ask questions or like others' questions in the chat. And if you do ask a question, please do mention which country you're based in so we can understand your context. Our teams will also be pleased to hear from you after the event. Contact details will be given at the end. We are recording the session today and will make the recording available to all participants. I'd now like to introduce Dr. Anthony Huszar, who will introduce the topic for today's discussion. Thank you.
Thank you, Simon. Good day, everyone, wherever you are in the world. My name is Anthony Huszar, as Simon mentioned. I'm a medical doctor by background, working on infectious diseases and health security. Like for you, this pandemic has changed the way we work, and over the last year we've been trying to help people pick their way through the science and the challenges that have come with COVID-19. I'm joined by my health colleagues Javier Martinez and Chelsea Stefanska, who will introduce themselves in due course. To set the context, there are many questions on our minds, some related to us as individuals, some related to our work and our businesses. Some are based on news of new variants, others are optimism as vaccines are rolled out globally. There are many questions, and as you may have guessed, the reality is that there are no straightforward answers to these questions, especially in the global context. So, rather than trying to answer each question, since what we predict today may be completely different in a week, we'll focus instead on the different factors, or what we call the variables, that can impact the course of the pandemic in the coming months. Understanding these variables can help us prepare scenarios to make better informed predictions. So hopefully, by the end of this presentation, we'll enable you to stay one step ahead. We'll discuss the key variables, provide some examples of how this might affect us all, and consider the challenges and opportunities that they present. By going through this process, we hope that you will have a better appreciation of some of the complexities, be able to plan more appropriately, manage risk, and improve your resilience to future infectious disease threats. I'll now hand over to Chelsea Stefanska, one of our in-house epidemiologists, to go through each variable in a bit more detail. Chelsea?
Hello, everyone. I'm Chelsea Stefanska. I'm an infectious disease epidemiologist on Mott MacDonald's global health team. So these are the key variables we'll go over today. Basically, what we want to emphasize is there's not a straight path to the finish line. There are multiple variables that we should all be considering when trying to plan ahead. So these factors can be broadly grouped into two categories. The purple boxes we're calling epidemiological variables, and the orange ones are more contextual variables. So it's a pretty fuzzy line, but we're thinking about the purple ones as more scientific and the orange ones as more human context. And today we'll demonstrate why predictions have more value when applied to a national context rather than broad global context. The first of these is new variants. New mutated versions of a virus tend to pop up by chance where there's a lot of transmission happening. It's completely normal for viruses to mutate. It's how they evolve. So to give you an idea of how often viruses mutate, there are actually over 4,000 different variations of currently of the virus that causes COVID-19. But most of these are very small, inconsequential changes. Mutations in the genetic code happen randomly, and most are irrelevant. But when there is an advantageous change, these mutations tend to be passed on and predominate over the other variants that are circulating. We already have variants that increase transmissibility, which make them harder to contain, and some variants may make current vaccines less effective. So new variants could cause cases to start rising again, even where vaccine coverage is high. This may impact mobility and travel throughout 2021, depending on where the concerning variants are. And this could become even more extreme if new variants pop up that make current vaccines much less effective. Vaccines are providing the most optimism in the pandemic and will undoubtedly be a key element in coming out of it. But there are still some hurdles and some unknowns. For example, the duration of protection is still unknown, so it's very likely that booster doses will be required periodically, and these boosters may need to be tailored to the new variants. We know that all the current vaccines protect very, very efficiently against severe disease and death, but we still don't know for sure if the vaccines protect against transmission of the virus, though a few have shown promising early evidence. There are also challenges with equitable distribution of the vaccines during this period of limited supply, most of which has so far gone to high-income countries. This may be alleviated by expanding the IP and manufacturing rights so that the vaccines can be produced in more locations, which is an ongoing global debate right now, but so far it's not happening. So the evidence is evolving, but until we know more definitively, it's really safest to assume that vaccinated people may still be able to transmit the virus to others. On a positive note, the longer this pandemic drags on, the more we are learning about the clinical course of the disease, meaning how the disease progresses in infected people. And as we've seen, this can vary drastically with a wide spectrum of symptoms. We already know about risk factors like older age and chronic diseases, but that doesn't explain why some healthy young people become severely ill and die, or why some people are sick for months with long COVID. And these are the puzzles that are slowly being pieced together by scientists and clinicians. So when we do eventually solve this mystery, which I strongly believe is just a matter of time, it will hopefully open more opportunities for better and more targeted treatment and prevention. Different parts of the world are at very different stages of the pandemic. Some countries are struggling to contain the latest wave, others have it more under control. Some countries will achieve substantial vaccine coverage before others have even given their first doses. And where the pandemic is not controlled, new, more vaccine-resistant variants could occur, which could set back global progress. And these differences between countries will continue to affect, for example, border restrictions, travel requirements, and there's a lot of discussion ongoing about vaccination passports to help enable international travel. This pandemic has demonstrated how interconnected the world really is. So one country's protection depends very much on also how other countries are able to control kind of their share of the pandemic. So we mustn't let our guard down if it seems like where we live or where we operate is doing well. The political systems and the ways in which government decision makers act on information is a key variable to predict impact of the pandemic in each country. And as we've seen, the same evidence can lead to very different courses of actions because decision makers are influenced by multiple inputs, not only the science. Plus, national interests are not always the same as global interests. We've seen this throughout the pandemic. Earlier on, there was banning PPE exports. So some countries had sufficient supplies while others didn't even have enough PPE for frontline healthcare workers. And now we see vaccine diplomacy, with some countries stepping in to offer vaccines to low and middle income countries, while others are buying up limited supplies for only their own populations. And this is really becoming a new form of diplomatic currency. So the implication of all of this politics and governance is that while we can use advocacy to influence decision makers to an extent. For example, for personal or business interests, we do really need to work within the regulations being applied in each country, which affects, for example, office or business reopening. A country's wealth and economic stability have determined the response to the pandemic, whether that's through subsidies or benefits packages or purchasing power for vaccines. Cost-benefit analyses help with decision making. Some analyses are simpler, where a modest investment yields high returns like face masks. But in most cases, it's much more complex, where economic activity is affected, for example, policies about closing businesses. But with all of these different cost-benefit analyses, one which really stands out is investing in improved preparedness for infectious disease threats. Looking back at what we could have helped at the beginning of the pandemic can really better prepare us for the future. This cuts across all different types of sectors and projects and could open opportunities to achieve greater resilience in the future against more infectious disease threats. National health systems have been pushed to their limits or over their limits, far beyond in some cases during the pandemic. Many countries don't have universal access to affordable, good quality healthcare, which may complicate vaccine rollout. And the focus on COVID-19 has also pushed back many other needs, routine needs like cancer screenings and surgeries, which will take a long time to catch up in the recovery process. And the health workforce has really suffered mentally and physically during this pandemic. People have been pushed to their absolute limits. So the implication for your business is that more restrictions get put in place when the health system is overwhelmed. So we need to keep an eye on response capacity by the national health systems in the countries where we work to anticipate future lockdowns. And last but not least, human behavior. So human behavior rooted in social and cultural values has played and will continue to play a key role in 2021 and beyond. After all, the pandemic is shaped by how people respond to it. There's fatigue, frustration, and uncertainty about the future. So compliance and confidence are two key issues to watch and also to try to influence with good, effective communications. And this brings opportunities for improving social outcomes. Now my colleague Javier Martinez will take over and show you some practical ways of using these different variables in our work. Javier, over to you.
Thank you, Chelsea. Hello, everyone. My name is Javier Martinez. I'm a public health physician working in Mott MacDonald's Global Health Team. In the next few slides, I will provide some examples of how we can use the variables. Given the varied sectors in which we work, some examples may seem a bit generic, requiring adaptation to our specific localities and priorities. In considering the variables together, we can make more informed decisions or forecasts about how things may unfold in general terms over 2021. This is useful to know because it can help us manage our risks as individuals and also as businesses. We are aware that some of these predictions may seem more relevant to those among us based or operated in a European or North American context. For your specific sectors, region, and context, additional adaptation will be required. One very important implication for 2021 that we are already beginning to see in a few countries is a reduction in the enormous pressure and burden that COVID-19 has imposed on our healthcare systems. As vaccination coverage increases, there will be more room for the healthcare system to treat more non-COVID ailments than it has been able to do so far. The relaxation will be incremental and will also contribute to mitigate societal, medical, and political concerns of overwhelming our healthcare staff and facilities. We also expect to see an increase in attention to infectious diseases, including more surveillance in countries that can afford to invest now in order to be better prepared than we were just 1 year ago. Apart from strengthening lab capacity, we could see opportunities in the wastewater sector for early detection of new variants, even before symptoms are detected among the population. People will continue to be afraid for some time, and we expect several infectious prevention and control measures to become common or even standardized across many sectors. Mass vaccination, where this is attained, will incrementally achieve what is perhaps the most important change required of all, a change in the mindset of our societies, that COVID-19 can be controlled, that it is safe to resume certain activities with precautions and vigilance being observed. This increased confidence will enhance, for example, the resumption of office work, with remote working still relevant, domestic travel, and outdoor spectator events. Large indoor events and international travel, on the other hand, could take longer to recover. For as long as access to vaccines remains unequal, large spectator events might represent a risk of new variants that could be resistant to current vaccines entering our more vaccinated countries. In sum, the gradual easing of some restrictions will take place alongside new and old challenges, depending on how quickly and effectively we are able to get the pandemic under control. Pandemic control is an important term. It is not the disappearance of the virus. It is about containing it and controlling it, similar to how we are keeping under control viral infections like measles or polio that, as you know, still remain among us. There is some way to go to get to that point. In this slide, we have prioritized 3 implications that cut across most sectors. Depending on our context, these implications can represent both challenges, but also opportunities. The first implication is the need to strengthen health and safety protocols to better protect our colleagues, staff, and customers. We are beginning to see this requirement built into tenders, feasibility studies, due diligence, and project management arrangements where, for example, international travel or work in project sites are required. A second implication is the need to incorporate digital technologies and new ways of working to make our projects and services more accessible and safer. Digital solutions can reduce queues and crowding, and contactless technology can reduce the risk of disease transmission, just to mention 2 examples. In Mott MacDonald, we also focus on connected thinking and social outcomes. And we are increasingly applying this concept to achieve, for example, healthier cities, where citizens can more easily adopt healthier lifestyles through more accessible, better integrated, and safer infrastructure and services. Healthy cities is a relevant example when discussing the implications of the pandemic, because cities bring many people together, thus increasing the risks of disease transmission. Lastly, the most important implication of this pandemic, particularly as COVID-19 is not a one-off, is the need to build pandemic or epidemic resilience into all our projects, infrastructure, and services. For the one thing we can predict is that there will be new disease threats coming our way in the not too distant future, and pandemic resilience will help us better deal with those. So what is pandemic resilience? Pandemic resilience is about learning the lessons from COVID-19 and adapting present and future infrastructure and services to the infectious disease threats to be faced in the short to medium term. We have developed our own approach to pandemic resilience in 3 stages. One step is reducing the baseline risk of disease transmission where possible, through, for example, measures that improve ventilation, better manage crowding, or enable contactless futures. A second step is ensuring that we can adapt by, for example, putting contingency plans in place. This is one area where the variables can help us consider various scenarios, but we must remember that the next epidemic or pandemic may have different transmission characteristics. It may not be, for example, conveyed through the air. The third step is to preempt and enable our infrastructure to change its function when necessary. We believe and are pushing for pandemic resilience to become an industry standard, just like fire safety or carbon neutrality have become new standards. Pandemic resilience ultimately aims at protecting people, enabling continuity of services, and reducing the potential economic losses caused by epidemics. These have just been a few examples of using the variables to make more informed predictions and to better manage risks. But please bear in mind that the more you apply the variables to your specific trade and context, the more relevant those predictions and scenarios will become. If you are interested in more information on pandemic resilience, please visit the site mentioned on the right-hand side of the slide, where you can find some of our materials. And this is all from us. Thank you very, very much for joining us today. And we look forward to your questions and comments. Please like any questions so we know which are more popular. And over to you, Anthony.
Great, thank you very much, Chelsea and Javier, and thank you for our participants for popping questions into the chat box. As Javier mentioned, be grateful if you could like the questions that are generating the most interest so we can focus our attention. To get things started, I can see there's a couple of questions on vaccine passports that have generated a number of likes. So Chelsea, I'm just going to read these two questions. I think there are quite a few parts, so don't feel like you need to answer it all in one go. Starting with a wider question from Sam Stronge, based in Ireland. Hi all, very interesting presentation. You mentioned vaccine passports, but it looks like WHO is not fully in support of them. Is there a reason as to why the opinions are split? Thanks. And Paul Eden, a related question, asks, how likely are governments to trust the accuracy of health data contained in various health passport apps under development? What checks and balances can be put in place to ensure health status is accurate and truthful? And how would this work in practice? So there's quite a few parts there, but I think if you just start with the first question from Sam, which is why are opinions split on health passports? Over to you, Chelsea.
Sure, thanks. Great questions. These vaccination passports are a huge hot topic right now. Many countries see them as the way forward to enable international travel, but the WHO has not recommended them yet. There's a lot of ethical considerations, considering that there's very different access to vaccines depending on where you are in the world. And so some countries have very little access to vaccines so far, and some countries like Israel and the US and the UK have much more wide vaccination coverage. And so it really kind of opens up, or not really opens, but presents this divide in society between people who have and people who have not. And so there's the ethical issues, and then even if vaccines were universally available, there's still some issues around duration of protection, if they protect against asymptomatic infection, and the timing of vaccinations before travel. And so there's still some questions that need to be answered before the WHO can confidently say that that this is a great idea. And they are looking into it. They have a working group to look into how this can be implemented effectively, although it'll be kind of temporarily, as there's some discussion on when very few people have the vaccine, it's a bad idea because there's so much disparity in access. When everyone has access to the vaccine, it's not really necessary anymore. But in the meantime, when the vaccine rollout is being is being rolled out around the world. This might be a temporary solution. Other question. Sorry, what was the rest of the other question, Anthony?
How do we get around the challenges of some of the data issues?
Great. So there are plenty of data issues, especially around standardizing between countries, because obviously if it's used for international travel, different countries around the world will have to be using the same system, or at least will have to be able to read the data from a different system. And so there's various working groups, and includes people from tech and health and all different parts of relevant stakeholders that are trying to solve this right now. I don't think they've solved it yet, as of what I last read, but there's a lot of people that are working on it. So I went to a presentation a few days ago that was talking about this issue, and that the key principles that the vaccine passports need to be designed around is that it's equitable, accessible, privacy protecting, which is a huge thing, and then scalable and sustainable. And so there's, apart from having it on your smartphone, people who don't have a smartphone are going to need to have a paper copy. The paper copy is going to need to be readable. And so it's all, it's a bit technologically messy around trying to make it work for everyone. But there are working groups that are delving specifically into this issue. And so I think it's only a matter of time before something gets worked out.
Great, thanks, Chelsea. I think the summary there is that it's still evolving and quite complicated. So we just need to keep an eye on it.
Complicated.
Great, next question. I think I'll pass this over to Javier. So this is a question from Zoe based in the UK. What does it mean that COVID-19 can be controlled in practical terms? Can you offer an example?
Okay, thank you very much, Zoe. So epidemic control, when we say controlling a virus, we don't mean that the virus will disappear or die, as some people put it. So we know that viruses actually last for many centuries, and we have recovered viruses that were prevalent several centuries ago. So when we say pandemic control, what we mean is that we have the means to prevent outbreaks becoming very large. And that is a strategy that is normally referred to in epidemiology as containment and control. So basically, if there are new cases, just imagine that a new variant is generated somewhere in the world, and it gets to a place where most people are vaccinated or not, so that variant can cause the disease. Making sure that that variant doesn't spread to too many new people so that we don't have a large outbreak is basically at the core of disease containment and control. It also means that we will have to continue to focus on the ability of our healthcare systems to trace contacts, to trace new cases, to be able to know the incidence rate, so the number of new cases that appear in the population, etc., etc. That is what we mean by pandemic control. I have referred earlier to diseases which are very well known to us. Measles, polio, and there are many others. We could think of AIDS or Zika. As you know, those diseases remain prevalent. There are new cases, and therefore it's not that we have totally controlled them, but we are able to control them through a combination of preventive measures, improved treatments. Think of AIDS 20 years ago and now. So in the case of COVID-19, we are probably going to get to a similar situation where we are better capable of treating it effectively, where we are better able to contain it and to prevent a large outbreak to emerge.
Great, thank you, Javier. So we've got the next question is, it's more about epidemiology. Chelsea, this is for you, I think. This is from Hitesh Dharma, based in India. It's got most likes so far in the questions and answers window. So the question is, last quarter, we felt we have better control over COVID-19. All sorts of theories most prominent one being herd immunity. But this month in India, I assume, they're back to record numbers of infections. What is the view on statistical trends on reduction of infections? Now, I suppose we probably don't know the ins and outs of the data in India, but perhaps you can comment more generally on how we measure these sorts of things. Chelsea?
Sure. So I think the prominent theory of herd immunity is going a bit out the window at this point, just because there's so many unknowns about whether people can, or mostly the duration of infection, I suppose, because in order to achieve herd immunity and maintain it, you need to keep that proportion of the population immune indefinitely. And so you can't vaccinate everyone 1 year and then as it fades, as it wanes, the herd immunity would disappear, really. So it's something that needs to be maintained very, very regularly and diligently. And so in order to achieve herd immunity and maintain it, we would have to have vaccinations kind of almost ongoing for years to come. And so it may be that that's the case, but I wouldn't count on it yet for a while. Hopefully in the future that's possible. So I think back to record numbers of infections, there are a lot of new variants that are more transmissible, and as vaccines are being rolled out, there's kind of this almost, this sounds very dramatic, but this battle between, you know, vaccination versus the virus and new variants. And so it will try to, not as much as a virus can try, but it will evolve to try to fight back against that and to stay transmissible and to maintain its position in the population as regularly going from person to person. And in order to do that, it needs to evolve and it needs to become more transmissible. It needs to possibly become resistant to vaccines. And so these record numbers of infections could be because of new variants and also because of this kind of fatigue in the population. I'm not sure what the situation is like in India. I'm American and I live in the UK, and so I'm watching the situation in these two countries, and I see that people are becoming a bit more lax with the restrictions. As lockdowns are eased, people are mixing more. They assume that they may be safe now because it's been such a long time. They just want to see their friends. And so with this increased mixing of people, that also it increases the infections. And so it's just kind of this process until we can get enough of the population vaccinated. I don't know, Javier, did you want to add anything to this?
Yes, I'd like to say one thing. First of all, that I don't personally like very much the term herd immunity, and many people don't, because I think it conveys the wrong message that there is something like herd immunity. There isn't. What there is herd protection. And if you want to understand herd protection, the best way to think about it is think of a herd of sheep, for example, and a pack of wolves attacking them. They are not immune to the attack. They are better protected because they keep together. With vaccination, we achieve something similar. We make people better prepared, better protected, because there are fewer people who can sort of acquire the disease or transmit it. But we are still a long way from that. And certainly we are seeing, I don't know in India, but today in the news here in Spain, they were mentioning about how, for example, in Germany and also in the UK, there are many of the restrictions are going to remain over Easter. So herd protection is not yet there, and it's going to take quite a while for us to reach that point. Thank you.
Thank you both, and I think it comes back to the presentation you gave earlier that there are lots of factors that can affect these sorts of things. It's not just down to the epidemiology and the science. There's also a lot of human factors. What measures have been brought in by the government, the economics, etc. So anyway, but thank you for the answer. So on to the next question. We've got one. I think I'll pass it over to Javier first, and then maybe to Simon afterwards from a business perspective. So the question's from John Hodinot. Sorry if I mispronounced that. The question is, we have seen huge changes in attitudes to service delivery using video and other virtualization technology over the COVID-19 period, and healthcare has been at the forefront. What do you think this will mean for the design of services and in due course for facilities if this trend continues? So I think this sort of speaks to pandemic resilience and better planning, and perhaps we can touch on how that's affected us at Mott MacDonald as well. So Javier first and then Simon.
Thank you. That's a very good question, actually. So indeed, we have seen huge changes taking place even within our healthcare facilities. It's not that our health facilities were not prepared, but our health facilities need to adapt to every new epidemic. And in the case of COVID-19, we have realized that new adaptation was required. So we have had much more remote consulting with our GPs or with our consultants. We have seen the way waiting lists are managed to change. We are seeing differences in how nurses and doctors approach patients and deal with them. I think many of these technologies or advances are there to stay. I don't think that the way in which the healthcare system deals with us is going to change substantially, but it is certainly going to have to adapt, because what we know now is that the best response when we feel unwell is not to go to the primary health center or the hospital and hope for the best. So we are introducing new ways of dealing with the healthcare system, and we are reforming the way our primary health centers and hospitals are being designed. The design of the future hospitals will have to take into account some of the elements that we have mentioned in relation to pandemic resilience. Ventilation is one. We will need to have waiting areas that are properly ventilated, and the GP rooms and the OP rooms will need to be better ventilated, at least as well as operation theaters are, etc., etc. Contactless technology, so that people do not need to touch a door, or when they get to the toilet, the bathroom, to touch the handle, etc., etc. So there are quite many issues that are being considered. I know because I'm talking a lot to some of my colleagues, engineers, most of them actually dealing with these issues, and I know that this is on the top of their minds. And over to you, Simon.
Well, thank you, Javier. And I guess the question was framed primarily around health, but I think we can apply it to many aspects of our lives, and I think we don't know how this is going to play out. And certainly at Mott MacDonald, we work to a range of different plausible futures when thinking about how our business might develop. Just take the whole idea of cities and of many people travelling to work all at roughly the same time, 5 days a week in a city, and whether that remains the model through which cities will continue to develop, or whether it will be a much more dispersed model with more people working from home, and so on. What level will people want to retain human contact in their business lives? These are all questions that have been tested during the pandemic. I think existing trends have been accelerated, in some cases very substantially, but quite how much elastic remains in the band, we just don't know, I would suggest, at the moment. So how much this creeps back to something not too different to what it was before the pandemic, and how much it actually changes things utterly, is something I think we will uncover over the next few years.
Great, thank you, Javier and Simon. Next question is for Chelsea, I think. So this is from John Cherry in Scotland. Would a benefit be to design building HVAC, which is heating, ventilation and air conditioning, to be able to boost the air changes in the future? So this is looking at one of the many risk factors for airborne infections. Chelsea.
Yes, thank you. Great question. So throughout the pandemic, the evidence has evolved substantially. At the beginning, we thought it was just respiratory and maybe not so much airborne, which is the very, very teeny tiny particles that can travel longer distances. But as the months went on and more infections got more evidence, we saw that definitively this is an airborne transmission situation. And so we have learned over the past few months the importance of HVAC systems and air conditioning, and the amount of air changes in a room, and the danger of having stale air and just kind of being in an enclosed space for a prolonged period of time without a lot of air exchanges. And it's an extremely important factor for COVID-19 and for respiratory infections in general. So I think this will probably be one of the most important changes that we can focus on in the future to to retrofit buildings or to build new buildings with a big focus on the air exchanges and a big focus on really circulating clean air throughout the building. Because if you're inside and it's cold outside and the windows aren't open, there's not a lot of airflow throughout the building, that's pretty much your only defense against airborne transmission of infections, is relying on a very efficient HVAC system, or I'm not in this very knowledgeable about HVAC systems, but basically the ventilation or the air exchanges, this is your biggest defense if you're indoors. And so I think it's extremely important for the future.
Great, thank you, Chelsea. And related to this, and I think this might be one for Simon, it's to do with building regulations. It's a question from Alan Hendry, and this is related to the WELL building certification. Is there a role for WELL building certification in this agenda? That's a WELL. If I recall correctly, it stands for something. He assumes there is, but do we have any views on sort of regulating, I guess, and certifying things like ventilation or contactless systems, and the role of infection prevention control in buildings?
So I guess I'm speculating like everybody else, but what I would expect is for the regulatory environment to catch up with this in due course, and probably relatively quickly. But as a precursor to that there will be voluntary certification that people can seek should they so wish, and that might then form the precursor to a more mandatory approach to standards later on. So I think there is a role, and I'm reasonably confident we'll see that develop.
Great, thanks. Thank you, Simon, and thanks, Alan, for the question. We've got a few more questions coming up. So the next one is to do with a civil health force. So it's a question from John Sherry again. I wonder maybe if we start with Javier, and then maybe Simon might have some ideas on this. So this is the question is: resilience appears to be a key driver. Would a civil health force be an idea for the future to allow resilience of the health service, and perhaps look to deal with supply chain issues? So there are sort of two parts to that. So Javier first, and then maybe Simon can comment on the supply chain side. You're muted, Javier. Javier, you're on mute.
Sorry, I was saying, would you mind to repeat the question? I apologize, the postman just came in as I was going to answer the question. So I didn't hear the question very well.
No problem. So the question is, resilience appears to be a key driver. Would a civil health force be an idea for the future to allow resilience for the health service, and perhaps look to deal with supply chain issues?
Yeah, I think not just for health issues, but across many sectors, across many types of infrastructure, across many types of services. So basically, we will need to become accustomed to the fact that different infrastructure and services will need to be watchful for the emergence of epidemics. So resilience needs to be built in all sectors. Each sector will need to be able to become more resilient in its own way.
And Simon, anything from you maybe on the supply chain side? Is that something that needs to be...
Well, it's going to be really interesting to see how governments respond to this, isn't it? Pandemics were always there on risk registers in many countries, but nobody took them seriously, despite the health professionals warning us that they were coming. So the resilience was not there. It will, I'm sure, now get a focus, but I think, as has already been said, it's a little bit unclear what the next thing to challenge society might be. So I think personally that resilience across society for a whole range of challenges. For example, cybersecurity is another one, is something that will require increasing prominence. Whether it gets it is another matter. I think John raises an interesting point around the supply chain. Should we be looking to have dual purpose manufacturing facilities, for example, that can flip from whatever else they're making to health related technology very quickly if they need to. I suspect those debates will go on, and we'll probably see different answers in different countries. And I can imagine countries with a more authoritarian tradition of government being quite structured about this, and I can imagine countries in a more democratic tradition finding that tougher. But I think it's certainly a debate that needs to be had, and I would hope is had.
Thank you, Simon. I've got a positive question here from Varun Malhotra in India. I can imagine all of you have something to add on this, so perhaps if we start with Chelsea, then maybe Simon, if he has anything to add afterwards. So the question was actually right at the beginning. I've only just found it by scrolling up the question list. So the question is, has COVID made any positive changes to how businesses across the world operate? If yes, what would those changes be? So what are the positive things? Chelsea.
I think my first thought would be more flexible working for employees, and so I know this is very limited in its scope in terms of what sectors have been able to do this, but a lot of businesses across the world have been able to offer their employees a lot more flexible working. This has improved some people's situation with childcare, with things like work-life balance, things like that. I know that hasn't happened for everyone. Some people find it very difficult to balance the home life and work when you're working and living in the same space. But I think that was my first thought in terms of positive changes. It's also pushed a lot of businesses towards digital, which was, some would say, an inevitable change anyway, but it's really kind of thrust a lot of businesses forward to make those changes to digital, which may have taken a lot longer anyway. We'll pass over to Javier now. You're on mute.
My apologies. I need to pass to the next speaker. I have the postman down and have to collect my register post. Murphy's Law, I'm afraid.
Okay, I'll pick it up, Javier. I think clearly the pandemic has been a global tragedy, and there are innumerable personal tragedies, and we shouldn't forget that. But I think the positives are interesting. I think, as Chelsea said, there's been an accelerant of trends that were happening anyway around digitization and so on. But for me, maybe the interesting thing is that so many different industries have learnt that when they're faced with an existential threat, they can cut through the red tape and really move quickly. And there are big questions as to if you can set up a hospital in 6 weeks that used to take 10 years. No, okay, I know there's a lot of caveats around that. What does that mean for all the other infrastructures that many of us on this call are involved in delivering? Why is it taking us so long to deliver some of this stuff? How can we make it more flexible to uncertain future needs? And so I think there are some really interesting trends there. And the other one, which is maybe less certain, is the whole kind of desire of many societies to create something better out of the ashes of the pandemic. And so potentially there's an accelerant there in areas like climate change, for example, and it will be interesting to see this November for COP26 in Glasgow, UK, what sort of commitments people are now wanting to come forward with that maybe would have been harder absent the pandemic.
Great, thank you, Simon. And speaking as a health professional who's been working in infectious diseases and health security for the most part of my professional life, it's really one benefit, I guess, that has come out of the pandemic is that this is now on people's radars. it's not to the health professional network. I think the pandemic was just a matter of time, and so this, you know, despite the tragedy, I think going forwards there are many things we can do better, and it's about learning our lessons to be better, to be able to prevent it better, and to prepare better should another one happen in the future. Good. Okay, I'm conscious of time. We might have time for one more question. I'm just looking through the list now, and then we'll have to wrap up. So we have a question here that Mauro in the UK has asked. So this is about using government tools, offering tools to the government. So Javier, you've been off the hook for the last couple of questions because of your postman, so I'll hand this over to you. So Mauro asks, East countries, I imagine that means East Asia, I assume, have been trying to stop the virus, while Western countries have tried to contain the virus. Can we offer governments tools to understand impact of different approaches? So this talks to research, perhaps, and some of the emerging evidence. Javier?
Oof, that's a very good and very difficult question. I don't know how I'm going to come out of this. So the argument is in the East stopping, in the West controlling. I'm not sure that that is totally that way. I think basically countries have been adopting different strategies and adapted those to their own circumstances. Asia has been hit by large epidemics more than the Western world in the recent past. And I'm thinking about avian flu, about MERS, SARS, etc. And I think there is more consciousness in the East about certain measures being important in any circumstances. For example, wearing masks. And we have seen many times on the telly that people traveling in some Eastern cities were wearing those. Why that was not being done in our area. So I don't think that the measures have been different as such, but they have adapted to the different circumstances. I think in the future we will need to continue operating like that. We don't know. One thing that we haven't said perhaps enough in this presentation is there are many we don't knows in this pandemic at this stage. One of them is, why is it spreading faster in some parts of the world than in others? Of course, there are many theories, whether it is temperature, climate, this, that, and the other, or genetic characteristics. The fact is we don't know. And what will remain important is that we adapt our containment control strategies to those circumstances. I want to say one last thing in reference to the last question. Before this pandemic, most people, if we asked, most people would have said, oh, controlling an epidemic is something that the healthcare system should do. I hope that now we all know that that is not the case. Controlling an epidemic is something that we must all do in our own personal business circumstances at our own level. So I think that's the big lesson from COVID-19 to the world.
Thank you, Javier. Chelsea, would you like to add anything to that?
Yes, I've just done a quick Google search because I like posting resources under these questions for people to read later. And if you look for elimination versus control of COVID-19, there's been a lot of kind of debate on this issue because certain countries have gone for complete elimination of the virus. They don't want any cases, and many countries, most countries, all countries in the West have gone for control and suppression. And I think the key issue is what's desirable versus what's achievable and actually possible within that system that you're working within the kind of government context and cultural and behavioral context. It definitely is not an approach for one country that could fit for all countries. So I'm just going to post a few links under that question that I've been looking at for the past 2 minutes. Yeah, so it's a big debate. We shall see.
Great, thank you, Chelsea. I'm very conscious of time, and I think it's probably time to close out very soon. So thank you for all your engagements and questions today. I realise there are a couple of questions that have come through in the last moments and a bit higher up in the thread that we haven't had time to answer, but we will follow up and seek to answer them and seek to answer any questions that have been unanswered. So in any case, we'll share the recording in a follow-up email in the next couple of days. In the meantime, if you do have any questions or you want to speak to us further on any of these topics that we've discussed today, please get in touch with us directly or get in touch with your regular contacts at Mott MacDonald. I'll hand over now to Simon to provide his concluding remarks. Simon.
Well, thank you, Anthony, and thank you, Chelsea, and thank you, Javier, for your insight, your expertise, and an absolutely fascinating session from my point of view, anyway. And thank you, everybody, for all of your questions. I think there's been a good number of very insightful, high-quality questions, which have certainly stretched the team, which is good. And so we were really pleased to have those and to have different perspectives from around the world as well. I think that's also something that we all need to learn from. As Javier said at the end, this is very much a problem that we all own. It's a bit like health and safety. It's not something we give to the health authority to deal with. So it's interesting to see how we're all taking our ownership of it in our different ways, in our different contexts through the questions. Please do continue the dialogue with the team, and it's been great to have you on the call. And with that, I shall close things out and bid you a good rest of your day, however long that is, depending where you are. Thank you.